Here's my disclosure. The Czech Republic is Central European country, but slightly biting Western Europe. HIV prevalence in the Czech Republic is still low. We have about 2,500 living patients with living persons with HIV infection, and but the HBV infection is still, the prevalence is very low, and we can see decreasing trend. What has changed in comparison to last year? The prevalence of recent and HCV infection and prevalence of anti-HCV antibodies in common population is four times higher than we originally supposed. In HIV population, B infection is quite low, about 2% of recent infection, and HIV and HCV co-infection antibodies has 11% of HIV positive persons. HIV subtype, most prevalent is subtype B. About the Hcv genotype distribution, the situation is changing. If 10 years ago we had studies that the most prevalent C genotype is 1B in 80%, so now in the recent study on 3,000 persons from common population, we can see that 1A, which was rare, is growing, and genotype 3 is growing too. It's because maybe of growing numbers of IV drug abusers, and because of foreign patients which origin is from foreign countries. Q80K variant is positive in 20% of Czech population. In a common population, we cannot see almost the genotype 2 and 4, but the other situation is in HIV positive patients where we can see genotype 4 in 16%. Main risk of transmission of HIV infection is in men having sex with men, about in 65%. B infection is transmitted since the Velvet Revolution by sexual route. Before it was nosocomial infection, and HCV infection in common population is most common in IV drug abusers, but in MSM it's in HIV positive population the predominant mode of transmission is sexual. We have almost all drugs very well available against the virus HIV. The data about what is the most common anti-retroviral combination we have from the Brno Center, and we can see if we compare last year and this year that it's relatively growing. That are relatively growing regimens with integrase inhibitors and relatively falling regimens with PI inhibitors. Anti-HBV drugs are also very well available in the Czech Republic. Maybe one specialty is in the Czech Republic in comparison to West countries that still in treatment of serious courses of hepatitis B, and in the case if we use anti-B drugs as temporary prophylaxis in artificially immunocompromised persons, we still use more lamivudine than tenofovir. In treatment of HCV infection, the situation is not as favorable. above you can see my waiting list. Those are patients who are waiting for DAAs, interferon-free, and those are patients which started treatment. Still, as I mentioned last year, we have a specific, so-called specific program with asunaprevir, but most our doctors don't use it. Grazoprevir and elbasvir is approved, but will be reimbursed maybe in April next year. Still, the most common regimens are interferon-containing regimens. I have exact data from Brno of about 200 patients. What percentage are patients on heart? It's almost 100%, and suppressed virologically are 82%. 13% of patients in the Czech Republic which have HIV infection, which had HIV infection, had died, and 70% of them in the stage 8. We don't have data about how many cirrhotic patients we have with Hep B, but we can postpone maybe data from the biggest transplant center. 4% of patients who undergone the liver transplantation are transplanted because of B infection. 16% because of C infection. What can we see in last 3 years? The opposite trend. Patients who undergo the liver transplant because of C infection till the year 2013, 1/3 of them had hepatocellular carcinoma. But now, in last 3 years, every 2/3 of these patients have hepatocellular carcinoma. What is good in the Czech Republic, that waiting list for liver transplantation is 84 days. In Slovak Republic, the HIV situation is a little bit better. The prevalence is 2 times lower than in the Czech Republic. HB infection is 20 times high according available studies. HCV infection is is same as in the Czech Republic. As conclusion, I want to tell that HCV infection is higher, much more higher than we supposed last year. New drugs for C infection, for treatment C infection, are still not satisfactorily available. I want to thank my colleagues, which gave me important data. I'm proud of my friend, old friend, is an architect who did this building in Bucharest. Thank you for attention.